doing? So showing you a picture. Okay, guys, thanks for coming today, those of you that were able to make it. I'm not going to say a whole lot, but this is Mark Zwicker, and I'm going to let him tell you everything about himself. He does work for Cerner, and so the only housekeeping rule I have is that this isn't about St. Patrick's community being able to talk to each other. It's not Epic versus Cerner, but anything that's objective information about Cerner, you know, where they operate at, how many employees they have, what kind of jobs they have, that's fine from a vendor specific, but we're not going to get into the whole politics of what's going on in Missoula right now. But he's non-clinical, and he's been working for Cerner about a year and a half. I'm not going to say any more about it, but any of those kinds of questions, this is your opportunity. He's been out there at different facilities. He's been working for a big vendor. Whatever you want to know about where you want to go, ask. We'll do the best we can.
Thanks, guys. Also, my throughout, I was actually born and raised around here, Hamilton, Montana, so local kid, it works. But I have my degree is in CIS. I do have a degree in marketing as well. As Carrie said, I'm not clinical. I did get a job in healthcare, IT. It definitely helps having a tech degree, having that blend of both technology and healthcare. There's a need for both clinical side and IT side with this new industry that is exploding. So, as Carrie said, I'm kind of here open for questions. If there's anything that you had on your mind, suggestions, I'll offer them. So, is there anything that you had?
Exactly what do you do? Do you travel from place to place? Do you set up some systems?
Right. So the question was, what do I do? What is my role? Do I travel? And what I am is actually a consultant. So I work on the client-facing side. I go to hospital to hospital, and I help design and implement their electronic systems. So in that, I take the knowledge that I do have on the tech side from Cerner and actually work with physicians and clinicians to find out their workflows, see how to best implement their current state and their processes to work with our electronic EMR. So, that being said, that is just one of many, many roles within the healthcare industry. So that is one side, and that is the client-facing. There are also kind of back-end sides. There are system engineers to where they actually work with the hardware side of the healthcare, setting up the networkings, the computers, all of that. There's database management where you really keep the data integrity, make everything running seamlessly. There's no loss of that information. Programmers, obviously, for the other side. Also, there are clinical sides, strategists that come out on the teams that I'm a part of who are really clinical based that do help assist with the workflows, and they really help me out with talking with the physicians, clinicians to help design that system as well.
Okay, I'll go again. Do you help write the programs? Do you help the clinicians write the programs to make them interchangeable for all throughout the healthcare system? And do you have a certain set of rules to do that?
So, in all honesty, I do not write the programs myself. I basically work and I figure out kind of the workflows, and these programs on my side as Cerner are kind of pre-built. There are a lot of wizards, and I do help build the system, but as far as coding itself, I don't actually do that. There are other roles, software engineers, that if there does need to be new code, things like that, upgraded, we take that from the client, figure out their exact needs, kind of put together a document, and then give that to the software engineers, programmers, and they implement that custom change.
Do you guys do you have to take interns or do that kind of stuff? Or?
Right. So the question was if we take interns, and yes, yep. So we do take interns definitely, and that is an excellent way to get your foot in the door. Work with a lot of interns and just getting that experience with not only the vendor specifically, but getting that exposure to the EMR itself, really seeing how it works on both the front end. Sometimes you can shadow facilities, hospitals out there, as well as seeing the office build and how it really works behind the scenes. Is definitely an excellent place to not only get your foot in the door, see if that is something that is good on that specific role, and then you can intern under different roles as well.
So maybe you could tell everybody where is Cerner located, and you're obviously still here in Montana, right? And you or are you? And then how do you commute? And maybe you could just give us throw a bunch of questions out there. You know, you're living the life here. Tell us about the life. Where have you been in the last 2 weeks? What kind of projects you working on?
Yep. So the question was, where am I based? Where do I go? And Cerner, where is Cerner based? So Cerner is actually based in Kansas City, Missouri, and that is where I live. That's not necessarily where I am all the time, so it's definitely a high travel role on what I have. I'm here in Montana for this week, and I do come out every other month or so, get to see the family. It's very good. But as far as travel, I really go throughout the United States. I'm going to Chicago next week, went to Arizona, Florida, down into Alabama, West Virginia, kind of all over California. It's really a high travel role, specifically on what I do. So if travel is something that you're looking into, it's definitely a good industry role to be in. Also, for that company, it is a global company as well. So that definitely helps if you're looking to go abroad. We have headquarters in Australia, Germany, London, Dubai.
Wow. Great, thank you.
Yep.
So I have a question.
Mm-hmm.
Now that you've been doing this for a while and you came out of CIS, is there a recommendation of something you would have liked to have learned about now that you know what you're doing that would have helped you in your current position? Something, other kind of program, class, or course?
Yep. So the things that would really help me out, as I said, in my specific role of being client-facing and working with the physicians, is definitely learning more a little bit on the clinical side. So if there's an extra class that you can take on things, meaningful use is huge right now. That is really the driving factor. Just knowing a little bit, kind of familiarizing yourself with the hospital setting and learning those terminologies, really the culture of a hospital overall, how physician, nursing, pharmacy, all of those kind of work together is very beneficial. Some other things that really did help me out overall with that is really owning projects or anything like that. So if there's anything you can do, intern under something like you said, take on something similar to a client to where you communicate back and forth to a client, you come back with the results, come back to them, go through that iterative process of basically finding out a need and analyzing that need, building that, and circling back to see if that need has been fixed is very huge.
So project management?
Project management.
Who could you shadow? I mean, how many, if you were going to start over again, you had the opportunity to shadow 2 or 3 different types of people in the industry, what are the 2 or 3 types you shadow?
The question was, who would you shadow if I could go back again and kind of
Like your last year
mentor
or something?
under somebody? That is entirely dependent on what kind of role are you looking at. So there are a whole bunch of different roles, kind of as I mentioned, within this industry. So it is really doing something similar to what I'm doing, traveling, being client-facing, finding out workflows, something you're interested, or is it programming, is it database management, is it project management? So is there a specific role?
Probably project management.
Okay. Yep. So for project management, I would do just that. Reach out to those people. If you could have an intern at any facility, shadow under there, really look at project management. If there is, like a hospital, community, if there's any chance that you could just ask questions, like set up a little interview with one of the project managers out there, see if they can work it into time, just see kind of what they're doing, come with a list of questions. So how's your facility working? Basically like that. How do you orchestrate your teams, things like that.
So do you think project management, would it, like if it was limited in a facility that's healthcare related, would project management of any kind of project be beneficial, learning that workflow of project management? Is that what?
Definitely. So project management overall is very huge. In fact, some of my project managers that I have on my team, again, have really had nothing to do in the healthcare industry side. They have gone in and they've just managed teams. They know how to work with people, time management, prioritize things of that nature. So really project management, if that's the role you're wanting to go into, almost any sort of project manager role, not necessarily in healthcare specific. If you can get into healthcare specific, that's definitely a plus, but honestly not absolutely necessary. Just having that skill set is very vital and beneficial.
Yeah, what is the duration of an internship and where would a person go to get one?
Alright, so the question was, what is the duration of an internship and where does someone go to get one? It honestly depends. So, as on the Cerner side, I've seen interns be in there for 3 to 6 months as well as a year, depending on the availability. Where you get one, you simply apply. So find a company that you're interested in and you basically request to have an internship. Probably type up a brief resume, what you're looking for, what your goals is, why you're interested in, and then.
So is there something, like if Patrick wants to know about Cerner specifically, do you know, does Cerner.com have, you could start there? And...
Yep, for Cerner, there is a website, exactly, Cerner.com. You can go in there and there's a whole bunch of links out there to tell you on these different processes, everything that Cerner is about, the logistics, where they're located, applying for that internship. They have an online resume to where you just upload PDF file of anything you want to share, and they'll analyze that and then circle back to you. So if that is something that you're interested as well, I would recommend definitely being proactive and calling, because right now it is a very busy industry, and the more proactive, if you just call every once in a while, the more they will notice. So, and that's definitely good.
And I can say, insider information, we just got notified. There's an intern who's currently in, I don't know if it's a CIS program, but it's the main campus, a 4-year program over at the university that's currently interning in Billings. And Billings has Cerner, of course, that's who we're partnering with. And so they're getting Cerner internship over there, which is why they're now being looked at as a candidate. And they can stay here in Missoula, now they want to move home. But they've had all that experience over there as an intern, and now they're applying for the job here in Missoula that we have posted. So, you know, with the EMRs coming out in all of these different facilities, there is a chance if you can get in the door, you'll get that vendor specific or some of this exposure now that could help.
One of the things I'll throw out there too, we, and those of you that are students in our program here, not very many students go out of the area for internships, but we really like to promote it. You know, I think we had one student 2 years ago went out to Microsoft and had a tremendous experience. But I also recognize a lot of folks are bound to this region, but very, very supportive of any type of you know, opportunities, other places. Go to Kansas City if you're interested in this. Go and apply at Cerner. You know, if this is what you want to do for an internship. But recognize too, you're probably going to have to leave, you know, our nice little Missoula Valley here.
World headquarters in Kansas City is huge. Raymond was asking me, because he all knew I went there for a while. It's bigger than most college campuses I've ever been on. I mean, it's building after building. Most of these folks don't even know some of their other colleagues. They've never seen them, and they're in the same city, but somebody's at the World Headquarters Training Building and somebody else is over at Building 242 or whatever these numbers are on these buildings. It's just amazing, all the different aspects of what goes on at World Headquarters there. And some of their employees are remote. I don't know if you know any. Our clinic, one of our clinical strategists is actually moving back east. That's where he's from. And you might, I don't know, Cerner has a rule, isn't it, like 2-year anniversary or something, you can start requesting to be based remotely and not have to live in Kansas City, although that's their preference, but at that point, and that's what he's done, he's been with them a little over 2 years, and so now he has an opportunity to live elsewhere. Because the travel's so expensive, as long as you're within so far of an airport generally, a lot of these big companies will let you. So my brother's a nurse that works for Siemens, which is based out of Melbourne, Pennsylvania, with headquarters in Germany. And he's been to Louisiana and Seattle and all over. And he gets to live in Pennsylvania with his family, goes to the Pittsburgh airport, gets on a plane and goes wherever he needs to go. And the rest of the time can work from home. So lots of interesting opportunities. Since we have an international airport, we qualify. Patrick, did you have a question?
Yeah, also what prior qualifications do you need to get in an internship, and also what kind of certification or other would you get after an internship?
Right, so the question was, what kind of qualifications do you need prior to an internship, and what kind of certification do you get afterwards? As far as qualifications prior, I am not aware of any off the hand. As I said, for Cerner specifically, if you go to Cerner.com, just apply for one, list what you're looking for, kind of what you have done, why you're doing that, and they'll contact you. Also for certification, you do have a mark after you complete your internship that does stay with you saying that you have interned under Cerner. I'm not sure if it's an actual certification. To be honest, I did not intern myself, but Cerner.com will have that information on there.
I also have another question now that I think about it. Do you have to pay to get an internship or no, or do you get paid for it even? And also, with your company, what kind of jobs would there be? And also, if you intern there, does that give you a better chance of getting a job?
Right. So as far as the paid, if you do not have to pay, I don't believe. I do not believe it is a paid internship. But as far as getting a job in there, yes, that is very huge. So if you do, and you're looking for a job in Cerner, most of the people that I do talk to that are internships, I'm not making any promises or anything, but they typically do end up taking a full-time role in the company.
So you talked about international or global things. Are there, is there a need, or have you seen a need for multi-language skills if you have something?
So, right, and that is definitely a plus. If international travel is something, really having that extra language skill is definitely a benefit. An example, we do have a French client that needed work. Not many of us knew French. There was one colleague who did know that, so guess who got the client? So if that is another language, just having a basis, definitely don't have to be completely fluent in the language, but if you do have a base and you can communicate with a foreign client, is beneficial.
I have an example. We have our next gen consultants that are on site, and her story was she had made friends with a Swedish exchange student who was, foreign exchange student that had been here in America. So she went over to visit, and they were sitting at lunch one day at her friend's place of work, and some higher up overheard their conversation. Now, Swedes speak English. It's their second. Most European countries have it as a second language. Came over and asked her if she wanted a job. Now, she was there just visiting, and she didn't understand, and what had happened was Sweden was working with a British company, and the stipulations of the contract were they had to have somebody on the Swedish team that spoke English as their native tongue. So all of the Swedish people could understand perfectly what the communication between the two, but the British contract specifically said it had to be at their native tongue. So she got this job and got to move to Sweden for whatever, just because she had English as her native language. So I guess what I'm saying is it doesn't matter if you are bilingual as much as if you wanted to go somewhere, sometimes there's international opportunities because your native tongue is English.
And that is the same case. Like I said, it is a plus to have a language, but not absolutely necessary. There are people who go out to Dubai to help teach, and really having English as your primary language is important. And if you just know your system and you go out there, you still do have the opportunity to travel internationally, just having English as your native tongue as well.
Would it open up a lot more opportunities if you had backing, like from different rules and regulations? If you had overseen people at, say, USDA, Social Security Administration, do a lot of laws and rules come into effect in the
Yep, so great question.
of where you are?
Yep, so the question was, does it help basically having a backing of rules and regulations, governmental agencies, things like that? The answer is yes. So there are tons of rules and regulations, and really that's the whole thing with meaningful use is, and just to kind of clarify, what meaningful use is the government basically proactively enforcing the use of healthcare. So what that means is that there are certain qualifications as far as electronic medical record that hospitals, facilities have to abide by in order to make meaningful use dollars. So it is definitely driven by rules, regulations, things like that. So if you do have a background on any sort of governmental agency, rules, regulations, you know kind of how that system works, deadlines on when you need to meet these, really what has to enforce, as well as looking at how to fix or work with a system to meet these regulations, that is very beneficial. It's a great question.
Patrick, did you have something?
Yeah. For either the job or the internship, do you have to move around like that? Or also, I know it's a common reason for going into computer fields. Can you work at home even for some of the jobs?
Right. So, as far as an internship, you would actually have to be Kansas City based. So you wouldn't be able to actually move there. You would have to relocate to Kansas City and be on site. And for the remote, there are virtual jobs where sometimes you can, but as Carrie mentioned, it really is a 2-year mark. You kind of have to put in your dues. You have to go into the office and work. But then after you have put in your dues, I mean, you talk to your manager, and then you can maybe work out kind of a virtual role.
And some of the folks that live in Kansas City I've worked with, they still have to live in Kansas City at this point because they haven't made whatever this anniversary date is to allow them more flexibility. But it sounds to me, at least with Cerner, that they're flexible as far as if they have family needs or whatever. The work that they're doing is remote in sense of, they've got conference calls and stuff. And when I was there, one of my solution architects stayed at home and dialed into the calls that I was on while I was sitting in the little office in Kansas City because it was only those 2 hours he had to spend with us, and the rest of the day he was dealing with other clients, so he didn't have to be actually in there. And I think it's a good, Mark might be able to elaborate, but if you can understand, the company wants to build that team atmosphere. They want you to get to know each other and get familiar with their rules and their policies and their culture, and so that's why they've got this in place, just to help you all adapt to that new culture, and then once you've learned it, then you get to spread out.
Right. I mean, in all honesty, it'd be great to work from home as much as you can, but one of the main driving factors on staying in office and going into your office for those 2 years is just that collaboration. I mean, if I have a question on something, I just look over to my other colleague's office and ask them the question and get an immediate response. Also, there are a ton of meetings on what we call knowledge transfers, to where if anyone learns something new, anything great, everyone comes together, collaborates, and then basically shares the wealth of information. So starting out, that kind of environment is extremely crucial, and it's really beneficial. It really helps you grow and develop into your role. So that's kind of the driving factor on why they really enforce Kansas City-based. And also, there's great barbecue out there.
Yep. Gates.
Yep.
Anyone else?
Well, our next subject is on the whole meaningful use, and for everything that I've read is all over the board. It's like, oh, well, if the meaningful use is I pull this liver out of the toe, then it qualifies, and then somewhere else, it's like 5 different things.
Mm-hmm.
Your thoughts on meaningful use?
So-
I mean, how good does it have to be good enough for you? How much improvement, how much help, how much worthwhile does what you do have to be meaningful for you? Does that make sense?
Okay, so just to clarify, the meaningful use actually the governmental regulation, or meaningful to me personally?
To you personally, for I'm doing something with my life that will help someday.
Oh, yeah, excellent question.
It's going to help other humans in the area or wherever.
Yeah, so the question is, basically, how is my role meaningful to me? How do I feel about it? And in all honesty, this is the wave of the future. So there are a lot of aspects to it that does make me enjoy what I do. So first of all, it's a huge wave of technology, shifting from paper to an electronic, being able to keep all that patient information together to where there is no data loss, there is nothing, discrepancies kept between there, and improving physician nursing workflows to where they can harness this information quicker and more efficient, as well as protecting patients' lives. With our system, we have basically what we call interaction checking. So if a patient has allergy A and they order drug B and they interact with each other, the system will fire an alert and ensure that that patient does not get that met.
Clinical decision support.
Exactly. Clinical decision support. So it's really a lot of different aspects. We're keeping patient information and patient safety, improving workflows, which if a physician can work faster, it means that that's more time they get to spend with the patient, which is awesome. Not only that, the wave of the future, that's only what's going on right now, but the goal is to actually integrate everything together to what we call a patient-centric system, to where everything kind of revolves around that patient, that information is harnessed, it stays together, and basically they can grow, they can be healthy overall. Instead of coming into a hospital while you're sick, the goal is to be healthy as a person in your day-to-day life.
So you feel fulfilled as a person. You do personally.
Yes.
You feel like you're making a difference.
Yes.
Okay.
Absolutely.
So you're talking about the physician working faster.
Mhm.
How's that going to encourage them to use checklists? Because checklists do a step, reach them, do a step, get a banana, basically, which isn't going to add to the speed, but it will add to the accuracy of the data collection and stuff. So you're going to get speed or you're going to get accuracy. You got to sacrifice something for the other.
Right. So that is one thing. The speed, that does come with time, in all honesty. So this is a learning process. When you first start out, it does get slower. But with what we do, since everything is stored, the data is centralized, it really decreases repeat data. So what you can do is, if you have a patient inside the hospital from day to day to day, you get to take that past information and apply it. Or if you have similar scenarios as a physician, you basically get to keep that information without having to write the same note or anything like that. Basically apply that to the patient and just change the little bit of information that needs to be fixed.
So to elaborate on that, because what we've been talking about in a couple of these lectures are how Some of the workarounds or some of the adoption issues are based on their dictation. So I've said that in a couple of lectures where a physician is trained or a provider is trained to do that narrative dictation. 35-year-old female presents with right lower quadrant pain, no history of blah, 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 and they go through and they're just recording this story as opposed to checking the boxes about how old they are or that it's right quadrant, abdominal, and doing all these multiple clicks. And what I hope Mark maybe will speak to a little bit, what he's doing for us is that CPOE, provider order entry. And when a physician writes an order set, and I'm just going to use a generic admission order set, they don't get to dictate that. They have to write it out longhand. And an example, and maybe this is something I can work at getting posted even for the next couple of weeks just for information. They start writing line by line, and I've seen these be 8.5 by 11 pieces of paper, 2 and 3 sheets of it, that they have written and filled in every single line that says, admit the patient to ICU. Vital signs Q4 for the first 8 hours. Then change vital signs to twice a day. And then, and they've got to write every single medication out individually, and they have to write everything that would be done to that patient. So insert the Foley catheter with strict diagnose for the first 2 days, then change to start to wean from that Foley catheter or start oxygen. I mean, every single step, if you could see these, they're just huge. And what Mark and I have been working on together recently is how do we get those 44 lines of orders into a one-click, and it's a general admission order. We do a one-click, and then they followed 80-20 rule. So 80% of the things that you would always do for every patient, we're always going to monitor vital signs. We're always going to monitor INOs. We're always going to monitor. So those things are automatically checked for the physician, but then the other 20% of things they could do for a person with this specific disease or this specific admission criteria is available for them to click quickly and easily, so that now what used to take them, I mean, I could see these hospitalists sit for 20, 30 minutes in the ER trying to write all of this out and hoping they don't forget something. Now we've built these power plans, which are groups of orders, very disease specific. They don't miss some of those quality indicators for diabetes. It's 1 or 2 clicks to get at least the ball rolling. And then if something is missed or a nurse has a question about where's this order for this, then they can go back in and just add it. And they can do it from anywhere in the hospital. So the hospital doesn't have to wait till they're done what they're doing up on 3rd floor to get on the elevator to come down to the ER. They can do a lot of these things from wherever they are, maybe 3 o'clock in the morning at home. So do you have anything to add? I pretty much.
Yeah, and honestly, just to elaborate on that a little more, it's more than just even placing those initial orders. With the electronic system overall, it takes away that transportation gap. So instead of having that order, waiting for that single chart, the paper chart that the patient has, you go onto any computer anywhere, and everybody can get in and document at the same time, so you're not waiting, and then it automatically gets electronically applied. Specifically for orders, you do not have to wait for those paper orders to go through the tubes, to go to pharmacy. There's a delay there to go back to the patient. The nurse has to check on it. It gets electronically routed automatically. So once that click happens, pharmacy gets the order. So it really diminishes and takes, I don't know, what could take 15 minutes to get that order to a minute.
So there's some efficiency that are probably bigger in patient safety that's bigger than where the physicians get hung up on this dictation of, it's the history of physical that they're dictating, the overall summary of the patient care. Does that work for you? Anyone else? Come on, guys. Here it is.
I've already taken like a lot of medical background type stuff, like what you're doing, a little bit, I think.
Your background's respiratory, right? Respiratory.
Was anyway. The informatics that we're supposedly getting here soon, right? Or we have the
new course.
New
that
course.
We're working on.
New course, new program.
Yeah.
We're working on.
So would that apply to Cerner in any way, or like credit-wise, or any kind of?
Would it help you in the future employment?
Yes.
So maybe I help you. So would a student benefit from going and getting a degree in specialized health IT as opposed maybe just general IT?
Yeah.
Absolutely.
And
That
an
was my
application
question.
process for CERN.
Yeah. So the question was, would having a healthcare information technology have an advantage over a regular IT degree? The answer is yes. So basically, any sort of clinical information knowledge background, that's really what Person from I know CERN is looking for. So any sort of clinical knowledge, if you know, like I said, the culture, how clinics, hospitals work, that information, how they store it, what you're looking for, is definitely advantageous.
Okay.
That was one of the things I said I wish I had for my job was some sort of clinical background. I only had IT, I was a CIS major. So when I went in there, I knew the technology side of it, but then I got hit with this wave of medical.
You didn't know the terminology or the.
That was something I had to learn really, really quick.
And so do you have some of your coworkers, do you know some of their backgrounds, like Brad, that's working with our therapies, he was a PT tech.
Wow.
So he wasn't a physical therapist, he wasn't an OT therapist, he was like their activities tech. I know that was his background. I don't know what computer background he may have had coming in, but do you know?
I'm not sure Brad's specific computer background, but as far as clinical background, I have tons of colleagues that work there, RT techs, pharmacy techs, everything around there, nurses. A lot of those. We have a bunch of NPs, mid-levels, things like that are in my role that are actually going out doing both that technological side as well as the workflow side, and that helps. So really having that exposure and having experience to that clinical side is really helpful. And from what I've heard, all those people that do have clinical background and information, they really do get snatched up pretty quick because that is a high need, and that's exactly what we're looking for.
So, and I have another example. I have one of the guys that works for Cerner that did our fundamentals, which is an introduction to the Cerner database and how it's constructed and how the primary and the foreign keys work to each other. He was actually a teacher who was a displaced worker, went back to school and got for radiology. So he took an 18-month program to be a radiology tech, worked 4 months as a radiology tech, happened to be at a bar having a beer, not that that's relevant, but somebody was celebrating their birthday who was a Cerner employee, and he kind of had a conversation with them, submitted his application via her recommendation, and got a job as a Cerner fundamentals. He had enough clinical, he hadn't worked long as a rad tech, but he does have some radiology workflow, but he also came out of a business where he was a teacher. So I know some of you guys coming from the mill and stuff and not being non-traditional have skills in other areas, whether that's a project management or an engineering or some of those things that are very applicable with any of this computer stuff you're taking, in addition to some health information technology components, that there's just multiple avenues. And if I was to be anybody, I'd want to be this guy that does the fundamentals, because I'm like poor Mark here. His day's done at 4 o'clock. He was in Aruba, Monday through Thursday he taught a class. Yeah, 4 o'clock in the afternoon he's done. Pictures of the beach, deep sea fishing. Poor Mark goes back to the hotel and has to figure out some of the workflow issues and write up his notes for the end of the day sometimes. So there is more than just the 8 to 5 that he does. But, I mean, who'd have thought an opportunity like that? You know, he didn't like being a radiology tech, but it was all he could do since the education dollars weren't there. You know, he'd been displaced. So took a chance 18 months later, and now he's living the dream. I mean, he loves it. He gets to go everywhere. Anyone?
Tom's behind the beer.
Hey, that
It's not doing yet.
smelling fine somewhere,
Good
right?
somewhere.
Okay. Anybody else have any other questions? Okay. Well, thank you very much.
Thanks, guys.